Welcome back to Taking Charge of My Cancer, the podcast dedicated to empowering, educating, and supporting you on your cancer journey. I'm your host, Derly Munoz, physiotherapist specialized in oncology rehabilitation, and together we'll explore integrative approaches for cancer care that focus in the whole person, mind, body, and spirit. Each episode will discuss nutrition, lifestyle medicine, natural therapies, emotional wellness, and the latest insights in cancer support and prevention. Our goal is to help you to feel informed, inspired, and more in control of your health decision. Because healing starts with knowledge, hope, and taking charge of your journey, let's get started. So I have an amazing guest, Dr. Elena Zincov. She's a trailblazer in women's health. She's redefining how women navigate their health journey with science backup, health span forward approach. As a naturopathic medical doctor and entrepreneur, Dr. Elena has dedicated her career to empowering women to thrive at every stage of their life. Her clinic is at the forefront of progressive therapies, offering personalized solutions for hormone optimization, longevity, and regenerative medicine. Her passion for transforming healthcare system stems, from her own experience with the limitations of conventional medicine. She saw firsthand how many women were dismissed or left without answers when facing hormone imbalance, perimenopause, and metabolic changes. She focused on democratizing women's health, ensuring that women worldwide have access to solutions that optimize longevity, vitality, and well-being. Her mission is clear: to give women the knowledge and tools they need to take control of their health on their terms and with confidence. So thank you so much, Dr. Sinko, for being with me today.
Thank you for having me. I'm looking forward to this.
Yes, so we've been trying to connect for maybe 2 months or so, and then one after the other happens. I'm so glad I'm able to finally do this with you.
Yes.
So, for listeners who may not be familiar, what is naturopathic medicine and how it does differ from conventional healthcare? Would you just give us some explanation?
Yeah, of course. So, naturopathic medicine is really the form of medicine. It's what I consider what medicine used to be like, where
Mhm.
you don't just treat symptoms with different medications, but you really consider the whole person and how the different systems in the human body are interconnected because we don't just start with a random symptom or a disease doesn't just start with a one specific organ. There's usually something that happened before that. And in naturopathic medicine, not only do we look at how the different systems work together, what are the underlying sort of root causes. There's usually more than just one root cause for why someone may not be feeling well. But we also have what's called a therapeutic order, which means we don't necessarily want to prescribe a higher intervention therapy without first working on the diet, on the lifestyle, correcting nutrient deficiencies, hormone imbalances, working on the gut. And we can certainly use different therapies concurrently or simultaneously, but we want to be able to honor that therapeutic order.
Oh, that's a very good explanation. I didn't know about that much because I believe most of you guys are in the California area, right? I don't think that.
We're
Oh,
everywhere.
oh, really?
There's naturopathic physicians. We are licensed in many states, and more states are starting to recognize naturopathic physicians. We certainly even do across the country, around the world. We do lots of second opinions, and we also can work concurrently with patients, primary care physicians, or other specialists. Naturopathic physicians, they're practicing in different clinics and regions all around the world.
Oh,
So
wow, that's amazing. Do you know if there's anybody here in Florida?
I think there's quite a few. Now, you just have to check the scope because the scope can vary state to state. But sometimes naturopathic physicians in California, Washington, Oregon, Arizona, a lot of other states, we have a pretty broad scope in terms of prescription treatments. In other states, potentially like Florida, that scope might be a little bit limited, but sometimes naturopathic physicians work with other MDs or DOs in the practice, and then they have the prescriptive authority as well.
I got
There's
you.
a few in the Florida area.
Perfect. Yeah, so I may want to kind of look into that.
Yes.
So for listeners who feel confused about hormones, can you explain what hormonal balance really means to them?
I like to joke sometimes that balance in life is overrated, but when it comes to hormones, I want to make sure that we're balanced. And hormones are interesting because too little of a certain hormone and too much of a certain hormone, you can have really similar symptoms, and more does not mean necessarily better. When it comes to hormone balance, it's not just about having a perfect or in range lab score. And I think this is where a lot of practitioners and patients can be confused. Well, my labs show that everything is in range and looks normal, quote unquote, but I don't feel normal, right? And this happens very common for women as we go through the different stages of life. And so part of finding that hormone balance is understanding one, that range is going to be different person to person. And some women do well on the lower part of the range. Some women do higher, maybe even potentially beyond their range. And this is where an example of testosterone replacement therapy comes in, where some women do fabulous when their testosterone is in triple digits, while other women can barely tolerate any testosterone. So different women will have a different range that sort of indicates hormone balance. But I think one of the things that is really important to consider as part of hormone balance is how does one feel? Because I'm not interested in necessarily chasing a certain number. If you overall feel very good in your life, if your libido is great, if your skin is great, if you're not losing hair, if you're not struggling with cardiovascular disease, memory loss, if your cycles are regular for younger women, we basically want to go head to toe and understand what is overall your physical, mental, emotional well being, and then pair that with the data. What do we want to do? And a lot of times women say, I feel fine. I probably don't have a hormone imbalance. And I say, most likely all of us, we're not perfect when it comes to hormones. If I dig a little deeper, I'm sure I'm going to find something.
Uh-huh.
And there's certain questions that I'll ask. They're like, oh, yeah, my libido is a little bit lower. I'm like, that's hormones potentially. And it's not just hormones. Libido is very complicated, but it's one of the variables. So I think it's very important to pair the data with how the patient feels. Now, the caveat to that is some women will say, well, I was able to achieve hormone balance and get rid of night sweats and hot flashes and brain fog naturally. And I feel great. And I want to applaud those women who can do that the more natural way. But I want to caution because how we feel, we may not necessarily know some of the underlying anatomical and physiological changes that could be happening.
Mhm.
Heart, cardiovascular, blood vessels, brain health, endometrium changes. We need to make sure that we're up to date in terms of imaging. And we need to make sure that our doctor is up to date in terms of what imaging studies we should be looking at in order to evaluate even bone DEXA scan. I'm surprised at how many physicians put women on even hormone replacements, and the woman feels fine, but she's losing bone mass. And the woman feels fine, but she's losing muscle mass. She can fit into her pants, but she still has not that great percentage of muscle mass. So we want to make sure that we're not just going off of how we feel is important, but we want to have solid data to support that what we're doing is working in our favor.
So how do you feel about sometimes I hear this quite often. So a lot of the patients and people who I know, we don't have as much functional medicine, naturopathic, and a lot of the people I know, at least here in the area where I live. So it's gonna be a lot of Western medicine, right? So your physician is telling you, but I did your hormones and they're fine. You don't need any hormone replacement, right? Because they
Yeah.
look fine. So why should I give it to you? So no, let's just, control this with that. So what advice would you give to that woman who is kind of coming across that way?
Absolutely. I have a couple examples. Number one, most primary care physicians and even OBGYNs and endocrinologists, hormones are not necessarily their specialty. Technically, some of it may be in their training, but they're not necessarily the person to go to actually evaluate a hormone imbalance. Now, they're good if something is way out of range, like 3 times the amount or very deficient, clearly very deficient. In those situations, they might be helpful. But if it's something in the gray area, many perimenopausal women, their labs look fine, but they don't feel fine. And so it's a disservice to women to say, well, you're fine. This is part of aging. It's probably stress. You're postpartum. Work is hard. You're not sleeping. Here's an antidepressant or anti-anxiety medication. Maybe that will help. You don't really fix that underlying issue. So number one, who is the doctor that you're talking to? Now, does it say in their profile that they have X amount of training, that they have these certifications? Are you reading the reviews that point out women who've had a great experience with them, that they're able to fix their hormones, that they have their life back, right? There's nothing wrong with having a fantastic primary care physician, a fantastic OBGYN and even endocrinologist, but then work with someone who actually specializes in hormone replacement, longevity, and metabolic health. So I want to add to that is don't let one no define your experience. It's like you're remodeling a kitchen, you might get 5 opinions. Most likely, you're not going to go with just the first guy that shows up, right?
That's a good point.
Reputation matters. Like if your girlfriend remodeled the kitchen and she had a fantastic experience, most likely you're going to go with that person no matter what, because personal experience matters. But if you don't like that person, you don't have to go with them. You could have 10 opinions, 20 opinions, honestly, however many opinions you want. Unfortunately, what I see happen very often is that women go to one healthcare provider and they accept no for an answer. In reality, there's probably a hormone replacement specialist just around the corner who's going to give you a completely different answer.
Okay, that's very good. Hopefully, I'm gonna get my friends and family listen to this
Yeah.
podcast. Like, here we go. It's not
Yeah.
just me saying that. From an integrative perspective, how are hormones connected with cancer risk?
Well, hormones are interesting because they affect all aspects of our health, which means that they also do influence how quickly and how efficiently cells grow and divide. And we know from research and a lot of research that's been poor research that was debunked that hormones don't cause cancer, that certain hormone replacement strategies do increase the risk of cancer. And we know this that it's not even estrogen, but estrogen potentially combined with progestin, the synthetic form of progesterone, can increase risk of cancer. But I say that with a word of caution because, again, hormones don't cause cancer. There's usually a lot more underlying issues that contribute to increased risk of cancer. Genetics play a big role, environmental toxin exposure, heavy metals, mold, which can disrupt how cells function, replicate, divide, grow, increase in inflammation, obesity, metabolic disease. We tend to fixate on hormones causing cancer, but in reality, our lifestyle and the environment where we work, where we live, what we eat, what we put into our body, what we don't put into our body play a much more significant role in cancer development. Certainly, hormones need to be kept in check, right? But we know estrogen doesn't cause cancer. Progestin paired with estrogen, yes, we do see an increase in cancer. And this is where we need to be more mindful. Who do we put on estrogen and progestin, right? Sometimes it's necessary, but why can't we just use bioidentical hormones? We know actually testosterone is extremely breast protective, and we see a reduction in breast cancer recurrence in patients even post breast cancer. So hormones are not the culprit, but it's usually part of the greater picture that needs to be addressed.
So that kind of make me think of multiple patients who I see. So we see a lot of breast cancer patients and they're come post treatment or even during treatment, right? You're in hormone replacement, you get diagnosed with breast cancer. The first thing that your physician is going to tell you, drop it. Need to drop everything, right? And then they already feeling awful for just dropping everything they had before. And then they're getting hormone blockers afterward, right? Because if the cancer is hormone positive, that's why. And sometimes they kind of like, well, how about testosterone, right? So if they like, yeah, you have a estrogen positive and progesterone positive cancer, but what about testosterone, right? Can this woman who has had hormone replacement in the past, who has been making them feel really well and having a great life until that diagnosis of breast cancer, can have testosterone. So a lot of medical oncologists really don't like the idea too much of that. What are your thoughts on that?
Well, I think a couple of things. One, why did the cancer happen in the first place? What was the environment that facilitated the cancer growth? Because again, it's not just hormones that cause
Mhm.
cancer. And I love my colleague and the work that she does, Dr. Jen Simmons, who is a breast oncologist herself. And she'll even say, of course, if you're going to biopsy that cell, it's going to come back hormone receptor positive because those cells have those receptor sites on them. But it's more important to understand what was that person's lifestyle to begin with, the risk factors to begin with, the landscape within which the hormones were operating. And it's not just hormones. How were those hormones getting cleared by the liver? I had a patient who came to me post breast cancer, and she had a history of alcohol use, pretty significant. Her oncologist and her primary care said, stop the hormones, but they never once talked to her about her alcohol intake.
Wow.
And your liver is going to process toxins first, and alcohol is a toxin. It's a legal drug, it's a legal toxin. that most people consume on a regular basis in more amounts than they should. But that's one of the biggest risk factors is actually alcohol intake, which increases inflammation. It prevents your liver from properly metabolizing hormones. Whereas that conversation versus hormones is what contributed to this. So for this patient, or for an example that you shared, I would say let's first work on the underlying landscape and then what's the environment that we're working on. Let's do blood work. Let's look at inflammatory markers, metabolic markers. Let's do a body composition analysis. We know obesity increase our risk of breast cancer by 30 to 60%.
Oh, yeah, unbelievable. Yeah.
And we see that actually hormones reduce the risk of breast cancer recurrence. And women died more of cardiovascular disease than cancer. So just the data supports the decision making, right? We can argue all day long, but the data clearly points, that hormone replacement is actually very supportive and preventative. And when it comes to testosterone replacement therapy, again, the data points to the fact that actually testosterone is very breast protective and we see a reduction in cancer risk. Now, I will say that there are different types of testosterone therapy, and testosterone in some women can get aromatized to estrogen. And we have to be careful because our body loves estrogen, and both men and women, our bodies love the estrogen pathway. And so we have to be careful and monitor this because I started the conversation with saying hormones are about balance. Too little and too much can
Mhm.
be problematic. And even if estrogen doesn't cause cancer, and we've established that, what if we have too much in proportion to other hormones? Now we don't have the checks and balances in place. And estrogen can be a little bit more pro cell growth, which is where progesterone is more anti cell growth, and similar with testosterone. So when it comes to starting on testosterone, the therapy matters. The monitoring estrogen metabolites matters. It needs to be a bigger conversation of how are we properly metabolizing those hormones. And if a patient is at a higher risk, is an estrogen blocker potentially necessary, right? To include in a small amount. So there's many different ways of introducing a safe manner, but you don't just put someone on a hormone replacement and say, all right, we'll see you in a year or two, depending on how you feel.
Okay. And now again, if you have that hormone replacement, right? And who do you go to monitor what path is this estrogen going, right? Because certainly sometimes Western medicine doesn't do it. It's like, nope, I'm just going
No.
to your panel of hormones and no idea. I heard the first time about looking into all these pathways through functional medicine and naturopathic medicine and other things that are not necessarily your traditional medicine. So
Yeah. Well, hopefully the doctor who's prescribing the hormone replacement is knowledgeable about even using a Dutch urine test to look at these different hormone pathways. Unfortunately, some people who are in a position to influence us in the perimenopause, menopause space have been saying that you don't need to test, just go off how you feel. You don't need the Dutch test. And I think it's unfortunate. And I hope that we can change that message because even though I don't use the Dutch test for total hormone levels or bioavailable hormone levels, I do love the ability to see which pathway, which metabolites are we looking at? Because you can have totally normal estrogen levels, but guess what? You're choosing the more pro-inflammatory pathway, 4-OH, 16-OH. And we know that those pathways are associated with increased risk of cancer and proliferative cancer. So we can't say that it's irrelevant. So it becomes really important that whoever you work with, whoever's prescribing hormone replacement, is actually testing and looking at those metabolites because then you can intervene. When it comes to supplements, when it comes to diet, when it comes to lifestyle, if a patient is consuming processed foods, not working out, drinking alcohol, and I'm seeing those pro inflammatory pathways really activated. That data provides the patient with information they need to almost make that change. It's not me just saying this, it's actually look at what your body's doing, how it's processing those hormones. And it becomes a moment of truth for them. Now, what if your primary care physician is prescribing the hormones, but they're not aware about the Dutch test? This is where I would look at something like the A4M provider directory, the Institute for Functional Medicine provider directory. Most physicians who are who have had their certification with A4M or Institute for Functional Medicine, they are aware of the Dutch test and they would rarely say no. And even if they maybe haven't ordered many of them, or that's not necessarily a test that they rely on heavily. Most of the time, if the patient is curious, they will order the test.
Okay, perfect. And that kind of link into my next question already, which you more likely already explain a big part of it, is like how does estrogen dominance mean? And again, it's really linked to risk of cancer, and you kind of already went over. Yes, if it is too much estrogen, that's why we want to know what is the pathway of elimination, right? Anything else you want to add to that, or that's pretty much
Well, just about estrogen dominance, that you can have totally normal levels of estrogen, but if you don't have enough progesterone in the system, you can feel that you have more estrogen running the show, like breast tenderness, water retention and puffiness, irritability. For women who still have a cycle, they can have much heavier cycles, very painful cycles, acne, PMS, PMDD like symptoms. So when we're thinking about estrogen dominance, not that you have too much estrogen potentially, but it's either A, in proportion, you have too much of it compared to progesterone, or you're potentially not clearing the estrogen efficiently, whether it's via liver or gut. So for women, let's say, who are constipated, who get put on hormone replacement and they're having one bowel movement per week, that estrogen is getting recirculated like bad karma
right.
in the body, and that can make you feel a lot worse.
Okay, very good. That's great. I'm so glad I asked that. That's a really good explanation because sometimes when I hear estrogen dominance, that you're thinking more like it's more estrogen in the body versus is what's dominant at that point. Great. How about estrogen metabolism for long-term health concerns besides cancer?
Well, we're thinking about metabolic health. And it's one of the things that I think is important to consider is with any hormones, whether it's growth hormone, testosterone, estrogen, or progesterone, a lot of women experience unnecessary weight gain and potentially metabolic changes where we're seeing changes in blood sugar, lipid panels, metabolic health, inflammation markers. So, insulin resistance. So, it's really important to consider, okay, are we treating one thing but then hurting another, right? So, when I'm thinking about estrogen replacement therapy or any other hormone replacement therapy, I'm always considering what's the safe dose, what's the minimally effective dose. And I'm not just checking hormone levels, I'm also looking at metabolic markers. I'm looking at inflammation markers, insulin resistance, just to name a few. But I'm really gathering the whole picture in terms of what am I working with and how do these hormones impact our overall metabolism.
Okay, great. That's very good to know. How about blood sugar dysregulation? You mentioned already insulin resistance influence hormone-driven cancers.
Well, inflammation can be a runaway train that it doesn't just damage tissues, but it can affect cell signaling and overall cell function. So you can take a completely normally functioning cell and inflammation, depending on the source of inflammation. But really, like inflammation is important. That's how our body repairs, but too much inflammation, and you can take a totally normally functioning cell and disrupt its proper cell division, growth, and division. So this is sort of like every cell in the body, and we have so many cells, right? Every cell in the body has a built-in mechanism that if something goes astray, there's a signal to go into cell death, apoptosis. But with inflammation, that growth and division cycle becomes jeopardized. And what starts within one cell then sends this inflammatory signal to the neighboring cells. And now you have a cascade effect where what possibly started with one cell now affects a whole tissue, as an example. So when we have blood sugar dysregulation, insulin resistance, inflammation, an increase in inflammation, then that directly affects cell signaling, potentially increase their risk of cancer.
Okay. So a lot of the times patients with diagnosed with breast cancer, for the most part, a lot of patients with cancer, but breast cancer, like stop having sugar because sugar feeds your cancer, right? What are your thoughts about that?
I think it's all again part of that balance. It's not like you have these cancer cells that are just, yes, in a way, it's an energy source, it's an energy fuel, but all within reason. I think if you're eating mostly a processed carbohydrate diet, then yes, right? It's not helping. Um, you prevent cancer or treat cancer, but I have to say it's all within reason, right? Like if you are actively trying to prevent cancer, trying to reduce your risk of cancer, or you're actively battling cancer, if you're eating 80 to 90% of the time a very clean diet, and you happen to have a bite of chocolate for dessert or maybe a scoop of ice cream, it's not going to be the end of the day. It's not like the cancer cell's going to, you know, take it all in. But if you're eating mostly processed foods, processed carbohydrates, baked goods that are high in sugar, then yes, right, we want to be able to change that. But I don't want people to fear. This is the thing. That's the thing is, I don't want people to fear that they have to be perfect. And if they're not perfect, that there's something that's going to happen to them, that there's something wrong. There's plenty of people who actually eat a completely processed diet and are
Right.
cancer free and are totally fine. And I think they just won the genetic lottery, or maybe there's some sort of psychosomatic component where they don't think about it, live a happy life, and they're totally fine. And then those of us who are drinking like celery juice, sweating every single day, and how somehow end up with this unfortunate diagnosis. So I like to think about a balance, and I don't like to practice or talk in a way that instills fear, right? I do think that there's a better way to eat, to move our body. I see that there's a huge opportunity to us to incorporate spiritual growth into our health and wellness so that we can be balanced mentally, physically, and emotionally. But I just don't want people to feel like they need to live in a bubble and completely deny themselves any pleasure in life.
Exactly. And I think I'm agree with you. It's amazing how sometimes, yeah, you meet people who, like say, have the worst diet ever, don't exercise, and they don't even have diabetes. They don't have any issue.
Right?
And then it's like you have like the healthiest person, workout, clean diet, and but again, stress is a big part of a lot
It
of people
is.
like that. And I think a lot of that is being driven by that. So I tell that to patients, again, if you have a birthday or you have a party and you have a little dessert, go for it. Alcohol is not good for you, but if you're doing you're having a cup of like a glass of wine because you're celebrating something, it's nothing
Of
wrong.
course. Right. Absolutely.
Um, are there specific foods that support healthy estrogen metabolism?
Yeah, and we touched briefly on this, right? Which is where we want to be able to limit alcohol, right? Of course, celebrations, occasions, that's totally fine. Processed foods in general are not very recommended, but a diet rich in cruciferous vegetables, rainbow salads, vegetables, variety is very important. Diets that are higher in fiber naturally, if you're eating more fruits and vegetables, berries, flax seeds, chia seeds, naturally your diet will be higher and fiber, which can support proper estrogen metabolism and clearance, right? Especially with bowel movement regularity. So I'm a huge proponent of cruciferous vegetables, root vegetables. The Mediterranean diet is probably one of the most studied diets in the world in terms of the amount of people that have been enrolled in those studies, the track record, and we know that it is very anti-inflammatory. So when we talk about inflammation as sort of this culprit for poor cell or improper cell function and increasing the risk of cancer, then the Mediterranean diet is one of the things that we can follow. But it also depends on individual, right? We can eat an anti-inflammatory Mediterranean diet, but hey, if you love your steak like I do, I love my steak. I will incorporate that into my diet as well. So I do have to say that green tea, right? So green tea consumption has been associated with lower risk of cancer. That is something we know certain cultures, right, include that as part of their just daily culinary experience. So those matcha lattes, potentially good quality matcha lattes, are potentially cancer protective as well.
Great. Is there any botanicals or supplements that you commonly use to support healthy hormone metabolism?
Yeah, I would say definitely B vitamins, methylated B vitamins are very important for liver detox pathways, support magnesium glycinate, like speaking of stress, that's a very important nutrient that our body quickly depletes in times of stress. Magnesium is essential for women, for sleep, for relaxation, bowel function. Glutathione is a very important antioxidant. NAC, which is it's a precursor for glutathione, also very important for liver health. And they've even done some studies to show that topical glutathione is better than even liposomal oral glutathione. So that's something to consider for our listeners. And the other very important compound is derived from broccoli sprouts. I'm sure you've heard of this. I think at this point everyone has heard of, but sulforaphanes, which are derived from broccoli sprouts. You can't eat enough. Say if you try to eat that many broccoli sprouts to get the actual sulforaphane content, you might tank your thyroid. So I don't recommend that. So you could just take one capsule twice per day on an empty stomach of sulforaphane extract to get the benefits.
And then how can people find the glucophene and the NSA?
And yes, so glutathione is I don't have any affiliations with anything I say today in terms of company supplements, just sharing what I know. But there's a product called Glutaril, GlutarYL. For our listeners, it's a topical glutathione. And again, they've done studies just to actually see increase in serum glutathione levels. That is something that people can order online. And AC is another supplement and acetylcysteine that people can order online. For those who love doing intravenous or IV therapy, you can actually do glutathione IVs. You can also do glutathione injections at home, although it burns and it hurts. So it's not my favorite. So topical glutathione seems to be the best option, but all of these things are available.
Perfect, perfect.
Street.
How do sleep and circadian rhythm affect hormone regulation and cancer prevention?
Gosh, well, I think sleep is one of the common denominators for many disease states and progressions. And unfortunately, especially for women, why are we more likely to develop dementia, Alzheimer's? Why are we more likely to develop autoimmune conditions, as an example? And why do we have certain increase in cancers as we get older? Not when we're younger, right? Because we don't really get the breast cancer or any of the other cancers when we're pregnant, which
Mhm.
is typically when our hormones are at an all-time high. And all roads sort of lead to stress and sleep as being one of the common denominators among all conditions. And unfortunately for women, we don't sleep when we're pregnant. We don't sleep when the children are born. And then we're working. And if we don't have the help at night, we're waking up and then we can't sleep during the day if we're working. And we do that for years, for decades. And we are sort of running on adrenaline and lack of sleep. And that certainly can cause cortisol dysregulation and adrenal dysfunction that can affect our hormone balance, blood sugar regulation. So when we're thinking of sleep, right, it's not just when we don't sleep, we're we're not able to recover or produce adequate amount of hormones that then we can then utilize during the day to help us do what we need to do. And then when we don't sleep, we have blood sugar and cortisol dysregulation. So it's not just a lack of sleep and feeling tired, but this cascade chain of events that happen that lead to metabolic issues down the road.
And we don't think about much. This happened to me, and I'm trying to be more conscious. Like, how can I finally, for God's sake, have a good 7 hours to sleep every night? And it's like, okay, I'm gonna go to bed at 9 o'clock, and then it's like 10 o'clock, and it's like, God. And then it's just so hard, you're right, because you just kind of go into this like, no, I gotta do this, I gotta do this, I gotta do this before I go to bed.
Well, and I like to talk to my patients about having a good stopping point, like deciding for yourself early in the day, what is a good stopping point for you, right? Because everything technically will be urgent as you make it. And so it's really deciding, is this urgent or can it wait until next day? And so that you don't hold everything in your memory, having a journal, just doing dump list of all the things that you're trying to get accomplished, but say by like 8 p.m., once I've done these three things, and don't make it impossible for yourself. Don't make like a 20-page checklist that you're like, I'm going to do this by 8 p.m. No, like, what are the top 3 to 5 things that you can be satisfied with? That if you're done by 8 p.m., this is a good stopping point for you. Because I work with my patients on this. It's like, look, you could work to infinity, but you have to prioritize your sleep and a good stopping point. Like my son, he's 9 years old, and he has this fear of missing out on life. Like he wants to come home from school, play his drums, go play basketball, go to the skate park, go see his friends, watch his favorite show. And I'm like, bud, you have to choose maybe like 2 or 3 of those things. And we have to go boom, 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 because he has a hard time falling asleep, feeling like he didn't get everything
My God.
done that he wanted to. And we kind of struggle with that as adults. Like, oh, I could work on my guide. Oh, I can work on this, the book, the podcast, anything else. And it's like understanding that sleep is important, nervous system regulation is important, and just sort of identifying not everything is urgent and what is actually urgent. I will say that for women, it's harder to do, especially with changing hormones, because progesterone regulates our circadian rhythm, our sleep cycle. So does cortisol. And if we go through times where we're not sleeping very well, that can cause circadian rhythm disruption. So getting hormones balanced, whether it's progesterone, cortisol, estrogen, testosterone, whatever that is, can help with sleep and can make it easier to go to bed on time.
Okay. And then, is any common misconceptions exist about natural medicine and cancer?
Naturopathic medicine does not replace cancer care. It can be used concurrently. It can be used as adjunctive care. But I've had people who have said, look, I don't want to do chemo. I don't want to do radiation. I have an XYZ cancer. I don't want to do what my oncologist says. And I say, I'm sorry, I can't help you because I can help you understand potentially what drove your risk factors. And I can help you on the other side of it, but I cannot go against what your oncologist has to say. Right. And it's risky business because I feel for people who see others share their story of how they quote unquote naturally beat cancer.
Mhm.
But I think it's a dangerous message. You can share the natural therapies that helped you for people to consider, but then those people try to go against their oncologist recommendation and it does not end up working out for them. And it's heartbreaking when that happens. And so naturopathic medicine, alternative medicine can work concurrently with oncology, but it should not replace the oncology care.
Will you give me an example for the audience actually getting chemotherapy for their breast cancer, any other cancer? How can naturopathic help to support that?
Yeah, absolutely. Yeah. So I currently have a patient who's actually going through chemotherapy and he's going through active chemotherapy sessions and it's not for breast cancer, but still very relevant because there's some overlapping therapies that we can do. But my job is to make sure that we monitor nutrient deficiencies and nutrient depletions. My job is also to make sure that the oncology team is doing the proper lab workup to make sure that it doesn't become an emergent situation and then they look at certain things. So I'm a huge proponent of looking at nutrient deficiencies, whether it's vitamin D, B vitamins, checking a fatty acid balance because fish oil is extremely important in cancer patients. It does provide an anti-inflammatory effect. It can also support healthy cells because chemo, as you know, targets absolutely everything in its path and doesn't pick and choose healthy or unhealthy cells. Part of what even my job is to make sure that I keep my patient as healthy as possible. So we use whether it's certain supplements based on the data or other interventions like ketones as an example, because a lot of patients who are going through chemotherapy are very tired, they're very depleted, very hard to do basic things during the day. So we'll sometimes use ketones as a fuel source to help patients at least feel somewhat better in between those therapies. There's very few therapies that you can include beyond something like thymosin alpha 1 peptide, which actually there's quite a bit of research that shows that not only can it improve chemo outcomes, but it also very protective for overall body exposed to chemotherapy and radiation. So it can at least help protect the healthy cells. And this is thymosin alpha 1, one of the peptides that I sometimes use. Of course, if the oncologist is not on board with that, then we do what we can, right? Because we're not going to override what the oncologist says. But usually they're very open to not crazy therapies, but if I'm looking to support my patient's protein intake, whether it's food form, supplemental form, if I'm trying to correct nutrient imbalances like I'm doing with my current patient from fish oil to amino acids, as well as vitamin D with vitamin K, B vitamins, magnesium, things to help them fall asleep at night, they're usually for it. And the other thing I'm going to add is if you're actively going through chemotherapy, you can work with an integrative oncology team, which usually they do have naturopathic physicians. There is integrative oncology training within the naturopathic field that some physicians pursue. And this is where you can come up with a plan of doing vitamin C IV therapy, doing MIB therapy. When can you include high doses of melatonin? When can you include green tea extracts, right? So this will really depend on what your chemotherapy radiation treatment timeline is, how often you get it, what do your breaks look like, and when you can include those therapies.
It is an institute, and I just blanking is it's a cancer institute, Dr. Connelly in California. I'm sure, yeah. And I heard them, and it's amazing. And I wish, we have something similar where I know they actually down-regulate the dose of chemotherapy because they've been supportive the way you just explained it. So you're doing vitamins, you're doing, red light, you're doing hyperbaric, you're doing all these other things to keep your body, and it's the same outcomes, and you're not creating this amount of toxicity in the body. So it's amazing. So it's really nice to know. And then if patients kind of find somebody like you online to help with that, or do they have to actually go and see somebody physically?
There's a lot of practitioners available online who can make the recommendations and potentially send the recommendations to the oncologist to review. And a lot of oncologists that I worked with now and in the past, they're usually very happy to review the recommendations. They welcome that. The worst thing you can do is tell someone to take something and their oncologist is not aware, and that's one way to piss them off, right? And in fact, any
Okay.
healthcare provider doesn't like to be surprised. It's not that we're territorial, but we just want to be aware
Yeah. Yeah.
of what's happening. But you can work with someone online just even to get a second opinion to understand what your options are, even if you see them for once, right? Or, once or twice. But I do think you can always see who's in your area who practices integrative oncology, but you can also see who's in a different state who would be happy to hop on a call with you, and not for a treatment purpose, but just to give you ideas to then work with your oncologist to see if you can incorporate it.
Perfect. And how can people find you? And I'll put that on the show notes.
Yeah. So I'm always active on social media, my Instagram at Dr. Elena Zincov. A lot of my posts are inspired by the questions that I receive from my followers. If I was not practicing medicine, I would not be on social media, but this is my way of sharing my knowledge, what I know, my professional, my personal experience. And then my website is drelenazincov.com.
Perfect. And I'll put that in there. So, what lab markers do you find helpful when evaluating hormone related cancer risk?
Yeah, so we want to make sure that we're testing all hormones, everything from a complete thyroid panel, not just the TSH, estradiol, and we talked about doing the Dutch test for estrogen hormone metabolism, testosterone, progesterone, definitely doing like a 4-point cortisol curve, which the Dutch test actually provides. So you understand, are you in a hypercortisol state or in a hypocortisol state? Just because you're stressed doesn't mean that your cortisol is necessarily high, because the body can only withstand that for so long. I look at IGF-1, insulin-like growth factor. I don't use it just for growth hormone therapy. I also do check to make sure, because it is, insulin is a growth signaling molecule. And again, part of that balance, it's in cancer patients who tend to run a bit high on IGF-1. And some would argue that it actually, IGF-1 serves kind of like a protective role in cancer, but we have to be careful with that, right? Is it adding more fuel to the fire, or what is it doing? So besides a complete hormone panel, I would include a complete metabolic panel. So A1C, insulin, both fasting and 2 hours postprandial or post-meal. IGF-1 already mentioned, inflammatory markers like HSCRP, ESR, looking at overall inflammatory landscape, immune markers. It's really common that if there's sort of inflammation like a runaway train, that sometimes we do have some markers that point to autoimmune conditions. And of course, depending on the cancer, right, we're looking at genetic screening testing. We're looking at potentially something like the Gallery test, which it doesn't have as high of a sensitivity for things like breast and ovarian cancer. Can be, a useful test. ARIA, the tear test. I don't know if you've heard of it, right? That's a good one to incorporate with lab testing, looking at proteins found in actually our tears that can indicate potentially breast cancer development, right? With ovarian cancer, we're thinking things like C as an example. And so I like to pair those lab markers together with imaging studies. So I am surprised at how many women start on hormone replacement, as an example, and they don't have a pelvic ultrasound,
Mm.
right? Very easy to do, can be part of an annual exam. Every woman should know if she has a clear pelvic ultrasound, not just a pap smear, but actually looking at how do the ovaries look? What's the endometrial lining like? We want to make sure that, again, we're proceeding safely.
Mhm.
HRT. But besides the Gallery test, the pelvic ultrasound, something even like a prenuvo scan. You've probably seen the prenuvo scans, which are like a total body MRI.
Mhm.
Those are becoming very popular. They're not cheap, but they can be very insightful to where they're not as specific as if you order an MRI that's like, let's say, shoulder MRI or breast MRI, right? That's more high resolution imaging. A total body prenuvo MRI scan can help guide your thinking process to see which area needs more focus. So even though it's a bit pricey, one, health is your most valuable asset. Two, if you try to MRI every single part of your body, it would be more expensive because your insurance would not cover it. So it's actually, I think it's a deal. But those are some of the imaging and lab tests that I would recommend.
Can I ask you a question? If we go back into that pelvic ultrasound, would you recommend that as well for patients who have like a partial hysterectomy?
So if it's a partial hysterectomy with like ovaries intact, is that what you're? Yeah, absolutely. Yeah, so that you can visualize the ovaries. Yeah,
Oh, okay.
yeah.
How often would you recommend that?
It really depends if there's nothing concerning that we see once every 3 to 5 years, right? If there's a changing symptoms, that may be once a year to monitor that. But it really depends on the presentation. Usually, if it's something that we have to watch and wait, right, it can be anywhere from every 6 months to a year. If it's pretty clear, then it could be anywhere from 3 to 5 years.
We should have like they should have a baseline for
Of course. Yeah. You should have a baseline because what if in 5 years, all of a sudden you're having random bleeding episodes,
okay.
cramp and painful cramping, right? Well, you want to compare that to your baseline
Okay.
pelvic ultrasound to see what the changes were.
Right. If you could give women one empowering message about protecting their hormones and reducing cancer risk, what would that be?
I would say get ahead of it. You don't have to wait for things to go astray or for something to go wrong. Get a baseline, find someone who will help you get a baseline, work with someone who can help guide you what your options are. Work with someone who doesn't instill fear, but instills confidence. That's what your podcast is about, right? Is really helping women make decisions with confidence, knowing their choices and their options. There's a lot of information out there, and you have to do your own research sometimes to understand what the right path is for you. And of course, the body knows best, right? So we all have something called intuition that we can listen to if something feels right or doesn't. I hope that women don't have to live in fear and that they understand what their options are and work with someone qualified who can help them establish the baseline and move forward with confidence.
That has been amazing. It was so worth like the many times we have to count down to this. That has been an amazing conversation. I can continue picking on your brain for another hour, but I gotta be respectful of your time. So I really appreciate Dr. Zincov for you to be in the show today.
Thank you so much. It was my pleasure.
Okay, you have a great rest of your evening.
Thank you.
Bye.